Hello guys, welcome to All Around Health Talk. Today we want to talk about birth control pills. What are birth control pills? Basically, birth control pills are pills that prevent pregnancy. How do they function? They have three main mechanisms. One mechanism, which is the main mechanism, is that they prevent ovulation. Ovulation is when the ovaries release mature eggs into the fallopian tube for them to be fertilized. So if these pills prevent ovulation, it means no egg is released, no egg is fertilized, no pregnancy. Second mechanism is that they create an endometrium that is not suitable for the fertilized eggs to implant themselves. So if for some reason these eggs are released, they become fertilized. When they get to the endometrium, which is the wall of the uterus where they're supposed to implant themselves and begin to develop, for some reason they get to that point of the wall of the uterus and they cannot implant themselves, which means they don't develop and we don't have a baby at the end of 9 months. The third mechanism is that they make the mucus of the cervix so thick and so hostile to sperms. So even if at the end of the day we have eggs waiting in the fallopian tube to be fertilized, the sperms that get released into the uterus cannot survive the thickness and the hostility of the cervix. So they don't get to the eggs don't get fertilized, and at the end of the day we do not have pregnancy. So that's how they work. There are two types of birth control pills. We have those that contain only progestin, and we have those that are combined, which means they contain progestin and estrogen. Obviously, those pills that contain both estrogen and progestin are much more effective. Basically, generally, the most common used birth control pills come with 28 pills. 21 of them are active hormonal pills, and the other 7 of them are actually placebos. Then they do not contain active hormones, which means it's like the rest period before you continue or before you begin the process all over again. Now, based on this, you would need to go to your doctor, have a discussion, and he would decide what method is adequate for you based on your health problems, based on your family history and all that. Now, so someone asked us what are the benefits of birth control pills. Basically, birth control pills are very effective. That is one of the benefits. They are very, very effective, and also they have the benefit of reducing your menstrual cramps. They reduce the risk of blood loss during your menstruation, and also they reduce the premenstrual symptoms that you have. So many people have symptoms before they start their menstruation. Using birth control pills would basically help you to reduce these premenstrual symptoms. These are basically the benefits. The disadvantages of birth control pills is that mostly you have to be conscious. It means that you can easily forget to take them because you have to take them every day. And in the case of the progestin only control pills, you need to take them basically at the same time every day, so it's easy to forget to take them. That's one of the disadvantages. Sometimes in some countries, in some parts of the world, they are really expensive, which is another disadvantage. They also are contributing factors to so many diseases, so many health problems, which we have mentioned in other videos, like they could cause obesity and other health problems. So that is also one of the disadvantages of the birth control pills. The main disadvantage of birth control pills is that they do not prevent or they do not protect you from sexually transmitted infections. In the case of condoms, that's like the advantage that condoms have over the pills, because apart from them preventing pregnancy, they help you or they protect you against sexually transmitted infection. So definitely your doctor will want to weigh the pros and cons and explain them to you for you to make your decision. So here we have the benefits and we have the disadvantages, but there's also one important pill we have to mention, which is the emergency control birth control pill, which is basically a pill that you take if you forget to take your normal birth control pills and you have sexual intercourse. It's an emergency pill, only in emergency, or if you're not using birth control pills, you use condom as your own method of contraceptive. Then if maybe for some reason doesn't during sexual intercourse the condom breaks, you would need to take an emergency pill. It's important for us to know that emergency pills are just like the name states, emergency. They're not supposed to be taken as we take the other birth control pills. They're just for emergency cases, and basically you have to take them within 72 hours of you missing your normal birth control pills or of your condom breaking. So within 72 hours. Obviously they could cause nausea, they could cause headache, vomiting. Those are minor side effects of birth control pills. And so that's what we have for you on birth control pills. We hope that you've learned a lot from this very short segment. Please don't forget to like, share the videos, subscribe to our channel, leave a comment, a question, whatever you have doubts about in terms of medical issues, and we'll make sure we get back to you. Thank you for watching as usual. See you next week. Bye.